Uganda, now in its second wave of the COVID-19 pandemic, is still grappling with the different mutations of the virus, just like many other countries in the world. Scientists from the Uganda Virus Research Institute have from the onset carried out what they call gene sequencing to understand the kind of virus they are dealing with. As of today, Uganda has more than 5 coronavirus strains, including the Delta variant. Professor Pontiano Kalebu, the executive director at the Uganda Virus Research Institute, says they have been studying the strain and now know some of its characteristics.
Now the nomenclature, the way they give the names has changed so that you don't stigmatize. Now they are called, the UK is called the Alpha, the South Africans called the Beta, then the Brazilians called the Gamma, and then the new Indian is called the Delta. But so those are variants of concern because we are worried that they're transmitting very, very fast, which is true. For instance, the Alpha was 50% more transmissible than the Wuhan. But then the Delta is even 60% more transmissible than the Alpha.
The coronavirus Delta variant, first discovered in India, has now spread around the world, and scientists say it may prompt further waves of infections.
Like the Alpha variant in the UK, they have noted that in some of the studies, yes, it can lead to more severe disease and hospitalization. In others, we don't have conclusive evidence that it causes severe disease. But like the Delta being more transmissible, so it means more people will have the disease, and hence you'll have more people in hospitals and people falling sick.
Professor Kalebu says studies on the number of cases as a result from the Delta variant are underway.
In this new wave, we are sequencing, and the last sequence data we had indicated that out of 31 sequences, 30 were of the Delta variant, the Indian variant. These are still early results. I'm anxiously waiting for the new data to come out, maybe this week, and then we shall see what we have.
But does this wave have an impact on the available vaccines?
In the lab, for most of these variants we're talking about, the Alpha, the Beta, the Delta, when you do in the lab, you find that they are less sensitive, or the antibodies that are in the lab that have been developed are less effective against these variants. But also the vaccines, some of the vaccines that are being used, it is shown that they may have some reduced effect on transmission, on the transmission of the virus. But the good thing, and this is very important, for most of the vaccines, including AstraZeneca, they are still effective against severe disease, hospitalization, and death. So what we are saying, if you take your 2 doses of your vaccines, they'll be effective against these variants.
Some countries have stopped the use of the AstraZeneca COVID-19 vaccine for the reason that its efficacy on the different strains of COVID-19 is low. However, Professor Kalebu says research on this matter is still ongoing.
The Beta you had, AstraZeneca was not very effective in terms of preventing mild disease and moderate disease in a small study. In Israel, you've heard recently that individuals who got the Pfizer vaccine, there were few breakthrough infections, but at least the reassuring bit is that these vaccines are still effective against severe disease unless we get any data information that is contrary to that.
Uganda has been red listed by some countries due to the rising infection rates, but scientists believe this could be a little bit late, especially given that there is extensive global circulation already. The current statistics here show positive progress, especially with steadily falling numbers of new infections and infection rate. Walter Mwesigye, NTV.